I think there is no way around it. It's very important to digitize. There is 3 reasons to digitize: high precision and quality, reliable and easy to use, and cost efficiency, I think, is very important. From chairside to the lab, it's very important. When using a digital system or choosing a digital system, I think what's very important is the open system. Open system, it means CAI, CAD, and CAM are completely open. So the dentist can do CAI alone, or if he wants, he can do CAD for chairside designing and chairside milling using the CAM. Or he can do CAI and CAD and do manufacturing outsourcing. So because of this, an open system is very important. If it is closed, he has to use a special software for designing and a special milling machine. When it's open, he can use a scanner and do whatever he wants with his digital workflow. I have a big experience with the treatment for full edentulous patient. It's been more than 2 years I'm using Straumann system, and I think it's a very reliable implant, especially the bone level, to use it as ProArch. When we say ProArch, it means the treatment for edentulous patient, that it can be removable over denture and it can be fixed. When we say fixed, it can be on 4 implants, 5 implants, 6 implants. And when we say removable, it can start from 2 implants till 4 implants. When we say treating a patient chairside, it means you have to use your scanner, design and mill immediately. So the best material must be a material that has a perfect flexure strength, perfect aesthetic outcome, and easy to use. Easy to use, it means easy in milling, easy in bonding, and easy especially in polishing. No need to use a special furnace. So what I think the Straumann nice material is the perfect material today to use, because it can give you a perfect flexure strength. It's already crystallized, no need to use a special furnace to crystallize it, and you can polish it by hand. So it means it's a quick and a fast treatment delivery for your patient.